Hi, everyone. My name is Erin Cooney, and I'm a patient at Thundermist and on the Health Center's Board of Trustees. I'm so excited for tonight's Ask the Expert. I, like all of you, have questions about the COVID vaccine and have been frustrated at trying to get it for myself and my family. Tonight, we get to ask an expert all of our questions. Isn't that great? If you have questions, please put them in the comments. Dr. Sapna Chowdhury is the medical director of Thundermist Health Center in Woonsocket. She is also the infectious disease specialist and is on the Rhode Island Vaccine Task Force. She is here to answer our questions about the vaccine tonight. Dr. Chowdhury, thank you so much for doing this.
Thank you, Erin. I always start by saying I'm not an expert. I think that's such a moving target that's a recipe for disaster. So to call yourself an expert, but I'm glad that we're having this conversation. I feel like after a very difficult year, there's finally a sign of hope. I see the vaccine as our way out of this. The vaccine can end this pandemic and help us get back to what we think, normal. And the number one question that I hear from my patients, my friends, my family is, when can I get the vaccine? Which is great because that means that they want the vaccine and will get the vaccine. And the purpose of this session really is to convince you and hopefully have you walk away from this session thinking differently about the vaccine if you're someone who is still skeptical. Thundermist and all other vaccination sites must always follow the guidelines from the Rhode Island Department of Health. In Rhode Island, they have developed an age-based approach to distributing the vaccine. Remember, we don't have as many doses as people, and that's the reason why we had to sub-prioritize in that way. We're starting with the oldest Rhode Islanders. Someone asked me in clinic today why, and that's because that's the highest risk group that will have the worst outcomes if they were to get sick. Then as more vaccine becomes available, we will start vaccinating younger populations. Eventually, we want to get to everybody. The Rhode Island Department of Health has a timeline, which we will share now, which shows you when certain age groups can anticipate getting their vaccine or will be able to get their vaccine. So you should be able to see that timeline on your screen now. And we will also put a link to this timeline in the comments section.
Great, thanks. Dr. Chowdhury, where are we now on that timeline?
So the quick answer to that is that today, on February 17th, people who are 75 or older can get the vaccine. And Thundermist is actively vaccinating this age group that are 75 or older and have received any kind of healthcare service at Thundermist, including dental or convenient care services in the past 3 years. So this could be any service at any location. But you must have an appointment. It's by appointment only. You can call our main number, which is 401-767-4100, and press 2 to make an appointment. We do recommend calling later in the day, like after 4 p.m. Our phone lines are often pretty busy during the day, taking care of healthcare related, COVID and non-COVID issues. This timeline will change, which is great news. This will change as of Monday, February 22nd, when scheduling will open to Rhode Islanders 65 and older. So right now, you should register only if you're eligible. And then, as I said, the eligibility criteria will change to 65 and older as of February 22nd, Monday.
Great, thanks. So I've got a few questions for you. The first one is the COVID-19 vaccine safe?
Yes, of course, that should be the question. That should be number one question. That was a question on my mind as well. Having had the vaccine myself, I researched this data really well. And I can say with great confidence that this vaccine is safe. The side effects that are publicly shared are mild and self-limited in most cases. Some people have minimal side effects and some will have a little bit more, but for the most part, it is very well tolerated.
So how does it work? How does the vaccine work?
Yeah, so everyone, is familiar with this term that gets thrown around, mRNA, and then, even with a little bit of scientific research, that immediately makes people worry. Is that a genetic? Is it gonna affect my genetics or whatever? So,
Right.
mRNA is basically a messenger. I think of it as if you sent someone a code. So it's basically what you inject into the body is a code, like a picture, a snapshot that you show the immune system saying, if you see something like this, a virus that has this spike protein on it, this is, you need to be ready to kill it. So it gives the code, and then it disappears. It never enters your DNA. It never gets into the nucleus of your cell, which is where your genetic material actually lives. The mRNA stays in the cytoplasm, and basically, once it's given the message to your immune system, it goes away. There is no permanent remnant of it left. Very effective. 95% of folks who get the vaccine may not get the virus, get the infection. Let me be clear about that. Not get sick with the virus, because we will come to this later. And so I'll save that discussion for the subsequent question. And then the vaccines promise you that if you were to get sick, you will not get severely ill, hospitalized, or die.
Gotcha. So what are the side effects? Do we know? I mean, what are the side effects of the vaccine at the moment?
Absolutely. Yeah. So, thinking about how tens of millions of people and even over 100 million people across the globe have gotten some version of the vaccine. So we are pretty familiar that I put them in two buckets, really. So locally, where the injection goes into your arm, most people will have some amount of redness, swelling, tenderness. It can be so mild that you can still go to the gym that day, or it could be that a day or two you may need to take it easy, but then it goes away. The local effects are transient. Then some people may have what we call systemic effects, which would be like fever, chills, and other things that you associate even with the COVID infection. And so that's the part that gets tricky, which should lead you to maybe reach out to your primary care provider, or do some research and think about it. Again, those are mild and self-limited as well. So locally, the arm, and then systemically, like fever, chills, sore throat, or flu-like or COVID-like symptoms can occur with the vaccine. But again, if they happen, they're usually not severe, and they're self-limited. They resolve rest and some Tylenol or whatever.
Go away pretty quickly. Okay. Mm-hmm. So what about like pregnant? If I was pregnant or lactating, is it safe to take it?
Yeah. Yeah, I'll start by saying that any decision made during pregnancy should be shared, and it should be a shared decision making with your OB, and they should be definitely part of the decision making. But the way I look at it is, this particular subgroup was not studied in clinical trials, but a lot of healthcare workers who have been the first line getting vaccinated have received this vaccine while pregnant and lactating. And as of today, I have not heard of any bad outcomes. And I would say to a friend, a family member, a patient, that I always do a risk-benefit analysis. What's worse for me and my fetus and my unborn baby? Is it if I get sick with COVID, or is it what could happen with the vaccine? And I think that the risks from getting or having the actual disease would probably outweigh any potential side effects, which would be similar to what I mentioned before. If they were to happen, there has not been any reports of bad outcomes in this population.
Great, thank you.
So the answer is yes. But again, after discussing with your OB.
Right. Okay. So how do we know who was included in the trials? I mean, is there enough testing done with just people like me? And
yeah, great question. And again, that's something that I researched for myself too. And, today on February 17th, I can tell you that on January 12th of 2020, we already knew the genetic structure of this COVID-19 virus. And then the studies began in March, and then went on, the phases of the studies. And finally, they were, and I'm quoting the Pfizer data because that's the one I have in front of me. So as an example, over 40,000 people were enrolled. and a quarter of them would be African American or Hispanic or Native Americans, and then the rest of them would be Caucasian. The ages studied were 56 to 85, obviously because the older age group was where we were seeing the worst outcomes. And almost half of this clinical trials were conducted in the US. Besides that, there were other South American countries, Brazil, Argentina, Germany, Turkey, South Africa. So bottom line is tens of thousands of people had already received the vaccine by the time Pfizer got its EUA. And similar data exists for Moderna as well. And even better than that, because we're having this conversation, a few weeks after vaccination has begun worldwide, we know that even in the US, 50 million or more people have already had the vaccine, and we have heard no severe outcomes, nothing that has made us pause and think, oh no, this is not okay. So within the clinical studies and even post vaccination, from what we know, it's still performing well.
Great. So why do I need to get the vaccine?
Yeah. So that's the $1 million question, right? So everyone's heard about the herd immunity, which is what it is basically a combination of, if you took everyone who got vaccinated and everyone who has been infected recently in the 3 to 6 months that we think the antibody lasts to keep you immune. And I'm making up some of these numbers because we know for a fact that 90 days is a good natural immunity window. Like if you've had the infection, you could consider yourself safe for that period of time. But in some cases, it's much longer than that. And so if we waited for 2/3 of the population to get the disease, those many more people would get severely ill and die. So you can reach herd immunity without a vaccine, but the price is pretty high. We've already lost almost 500,000 people. And so we get the vaccine so that we can get to that magic number faster, like a little over 200 million is where you need to be. We don't exactly know what herd immunity is needed to stop this pandemic, but the general cutoff has been like, let's get to like 70% or so. And so we want to get there with more vaccine than actual illness so that we can prevent more hospitalizations and more deaths. So
what exactly is herd immunity? What is herd immunity exactly?
So if 7 out of every 10 people had either disease or vaccine, there would be those many less people transmitting. And so there would be a halt to the pandemic from just no transmission or low transmission. So the goal of vaccination is to stop the pandemic from spreading. And the goal of herd immunity, and when you hit herd immunity, that's when things start to slow down. And that's where we want to get. So I think, does that answer your question?
Yes, that does. Mm-hmm. Yes. Yeah. So how much is the vaccine going to cost me?
So I think it's supposed to not cost anything. I mean, and then, anyone who wants to jump in and correct me. I mean, I think the federal government, the state government is very motivated to stop this pandemic. I did do some research in case people were like interested academically. So the Pfizer vaccine costs, and I was surprised. I was expecting the number to be a bit higher. For 100 million doses purchased, it cost about $19.50 per dose, and Moderna around $25 to $37 per dose. But remember, these were doses that were sold in 100 million doses, so
right.
It can change. But this is not a price that comes to the patient. This is the price that your government has absorbed, and I don't think anybody should be getting any bills. And if you do, you should question it. There may be some administration fee that private pharmacies may charge, but I don't think that's happening even. I just don't want to say it categorically, but my impression is that the vaccine will cost nothing. It is free.
Great.
But I just looked up the number just because I was like, oh yeah, I want to know.
Yeah. So can children be vaccinated?
So at this point, the Pfizer vaccine is approved for 16 and older, and the Moderna vaccine is approved for 18 and older. Clinical trials are ongoing for younger age groups, but at this point, of all the available vaccines, the youngest we can go is 16.
Oh, okay. All right. Can you get the COVID vaccine if you've had COVID-19? Should you get the vaccine?
So that's a little, so the quick answer to that is yes. If you've had the disease, you can get the vaccine as long as you have completed the required isolation period and you're recovered. Your symptoms have resolved and your period of isolation has ended. And then, but like I mentioned before, a lot of people also believe that for a period of time you are safe from a reinfection, and so some people may defer vaccination by 3 months or so because they just recently got ill, but you don't have to.
Okay.
You could get it as early as 10 days post infection if you're better and your isolation period has ended.
Okay. How long does it take for the vaccine to work?
So for both the vaccines currently approved are 2-dose vaccines. The Pfizer vaccine is 21 days apart, and the Moderna vaccine is 28 days apart. 1 week after the Pfizer and 2 weeks after the Moderna, you are considered fully immune.
After the second dose?
After the second dose.
Right. Okay. So I got the vaccine. Do I still have to take precautions not to get COVID-19, or am I immune?
Yeah, absolutely. So the Department of Health strongly recommends, the CDC recommends that you continue to mask and social distance, but with a little bit of confidence, because now you know that you are protected if you were exposed. But just to refresh everyone's memory, when we mask, we protect others. Outside of the medical grade masks, the regular old cloth covering or surgical mask even cannot entirely prevent acquiring infection. So theoretically, if you've had the vaccine, you can still be contagious. You can still have a mild version or an asymptomatic kind of infection where you could potentially infect someone else. We just don't know enough about it to say that can't happen. So theoretically, it can happen. So we do recommend that you continue to mask and social distance until those guidelines change, and they have not changed yet.
So the vaccine, will it prevent me from spreading coronavirus, or?
No, it won't.
It won't.
But if you mask, you will. But without a mask, no, because you may feel completely well, but you may be releasing virus when you cough or sneeze or even talk loud or laugh or sing. In whichever way, you could potentially, send the virus into the environment.
Gotcha. So what if I get a call that I can receive the vaccine earlier than the Rhode Island plan? Should I do it?
So that's a very interesting question. So the answer is no, unless it's your own doctor's office calling you, and in that case, you should figure out, why are they calling you? And again, I don't want to confuse people. You want to always follow the guidelines that are coming from the Department of Health, and when you're eligible is when you receive the vaccine. So unless it's your doctor's office calling you, if someone's trying to sell you vaccine or tell you that there's vaccine for you, I would suggest saying no, because it probably is not a reliable source.
Got it. Yeah. So you said that you got the vaccine. Can you talk about your experience with getting the vaccine?
Sure. And like I said, I freely admit that I was cautious and I read all about it and I was ready for it. It wasn't bad at all. I knew what to look for. I knew what to be prepared for, and I think we've talked enough about side effects, and enough is being said on reliable news outlets and new press conferences from the Department of Health that are telling people what to expect. And so most people that I know and myself have had a tolerable post-vaccine. Most people know that the second dose can sometimes be a little harsher than the first, just because your immune system is already primed. But I did fine, and I will continue to recommend the vaccine to people that I love within my family and patients that I care for.
Great, thank you for that. So with that, if anybody has any questions regarding the vaccine, you can leave a comment in the comments section. But I think that wraps up our questions for tonight. If anyone, like I said, has any comments or questions, we'll get back to you. So thank you, everyone. I hope you enjoyed getting to know more about the COVID-19 vaccine. And thank you very much, Dr. Chowdhury.
Thank you so much for having me.